Hello, I'm Adam Giragosian. This is Kadiatu Fofana, Josephine Tuam, and Nicole Kajusa. We are doing a presentation on staffing issues in nursing for our leadership class and our Bachelor's of Science in Nursing degree. I'm going to start off by talking about some of the staffing issues for this class. Nicole, will you please?
Now I can take it from here.
So to start off, we're going to talk about all of the staffing issues that we come across in nursing today in our profession. One of them is the demand for nurses. In our increased shortages that we have a higher demand of patient load for each of our nurses, which is causing a little bit of fatigue and burnout. We also have a very culturally diverse group of people in our staff. That is another issue that we have for our staff. Inadequate resources for these nurses. A lot of them are coming over with language barriers and education barriers. There's an increased complexity of healthcare with what nurses have to do in their job these days and what they're asked to do that's outside of their realm of practice. And the increase of technology, the advances of medicine, all these are new things that we have to adapt to every day. Poor working conditions and reduced nursing budgets. Hospitals are always trying to save, and it seems that the nurses take the load first. Also, schedule conflicts where nurses only work 3 days a week, but with the shortages, sometimes we have to work overtime for our floor, which leads to tired and burnout, fatigue, and that can contribute to all kinds of nursing staff issues. So some of the statistics that we're going to talk about this issue, there's going to be an increased need for nursing jobs throughout 2022. I think nursing jobs are always going to be relevant throughout history. There's going to be more nursing jobs than any other profession. Baby boomers have reached that age of healthcare where their health is going to need more assistance through healthcare. And it seems that the RNs are going to need to take the blunt of that as well. 500,000 seasoned RNs anticipate to retire by 2022. The United States Bureau of Labor Statistics predicts the need to produce 1.1 million new RNs to replace retired nurses to avoid a nursing shortage. So not only are we getting to that generation period where a lot of these nurses that were trained years ago are starting to retire, plus the need for new nurses to come on that we don't readily availably have right now. There's a lot of nursing schools out there, but there's increase of competition and secondary schools. So massive reduction in nursing budgets combined with the challenges presented by the growing nursing shortage have resulted in fewer nurses working longer hours and caring for sicker patients. More statistics continuing. According to Rosenberg 2011, the risk of death increases by 2% for each below target shift and 4% for each high turnover shift to which a patient was exposed. And about 1 million registered nurses are currently older than 50, meaning that 1/3 of the current nursing workforce will reach retirement age in the next 10 to 15 years. Nearly 700,000 nurses are projected to retire or leave the labor force by 2024. So this is just reiterating the need for us to produce nurses in the next 10 to 15 years due to the retirement of all the nurses that are working currently, and the increased risk of death when we are overworking our nurses and having to put them at risk for injuring their patients. Cultural diversity in education. Josephine is going to talk a little bit about this.
So the U.S. population has become more culturally diverse. We see more minorities in the healthcare field, and especially in nursing, we see more minorities. So there is a need for cultural respect and understanding. Staff members need to understand each other's culture and respect them. Managers are also to respect other cultures and try to employ more people from other cultures. We need a well-organized, diverse workforce which requires leadership and well-planned group activities. Now, some of the negative impacts on patient care and nurse well-being. Nurses work 3 days 12-hour shift. Most of the time, some people even work like 4 days or 5 days because of the shortage, so it has an effect on their personal life. They don't have time with family members. It's work, 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 and sleep and stress. It's a reduction in work productivity, negative attitude. They're so tired and the least thing. And then poor health consequences. Also have physical and mental strain. And nurses tend to have more cardiovascular problems. They suffer as a result of the long shifts and long overtime. In 2010, there was a study which shows that there was a clear trend between frequent overtime work and incidence of heart disease among nurses. It is believed that more nurses report 3 to 4 hours of overtime per day, which is 1.6 times more likely to have cardiovascular health disorders.
Now I am going to talk about nursing fatigue and how that have mental fatigue. A lot of the nurses, because of the long hours, they are stressed out, they get anxious, they are very exhausted, they get agitated, they are sleep deprived, they get depressed, and that could lead to smoking and alcohol abuse. And also nursing fatigue can also have a huge impact on the nurses' physical health. A lot of the time, a lot of nurses have to retire from nursing very early because of musculoskeletal disorders, especially back injuries, not able to use proper body mechanics properly. They get all tired and all frustrated and, will just get snappy. Also, when nurses are not really sleeping well or their mental focus is not there, they are more liable to having needle sticks, work-related injury, work overload, extended work hours. For the most part, nurses are always like staying late and go home late at night, and so that causes burnout, headaches, and sometimes they work these long hours and not able to stop to eat proper food, or not able to sleep well at night, so that relates to cardiac issues, electrolyte imbalance, because sometimes you're not even able to stop and take a good break to drink, or eat when you were supposed to eat, or have a good breakfast or lunch. So they get dehydrated and, hold their bladder too long, not able to pee. So all these issues, eating poorly, and sometimes when you get off late at night, you go home and eat late and go to bed, you gain weight. So that, all add to your esteem, poor esteem, because you've gained weight since you started this new job and you're very tired. And also, this nursing fatigue also have, a big impact on patients' health as well, because when you're not focused and not able to concentrate to do your work properly, that alone is a danger also to the patient and even you. Nurses who are very fatigued tend to cause a lot of medication errors. Patients falls because they're not there to pay attention to, the bed alarms, or thinking properly to try to help this patient. Also, documentation mistakes. A doctor could give you an order on the phone, and if you're not paying attention or you're really tired, you might write the wrong order the doctor gave you, so that could lead to more trouble for the patient. And even the nurses also have work-related injuries just because they are very tired. And also the legal ramification that could cause the nurse to lose their license because they did not do something that they were supposed to do. So that have an impact too on the nurse and their family, because they could be the sole breadwinner of their family. Increased mortality rate. So overall, it's not a good thing. So we need to find ways to bring all these issues rest. Nursing fatigue also is a big problem in the hospital settings because the use of overtime that offset chronic understanding and fluctuation in patient census increase hospital costs because hospital have to pay a lot of money, maybe like to settle cases just because a nurse was involved in not doing something right that they were supposed to do, and then leads to damage or another more health issues for that patient. The errors of all the fatigue increases, and the hospital have to budget for all these things where they have to pay more money for all these things to fix the problems. Also, the rise in hospital-acquired infection, that causes the lapse in infection control process, also causes the healthcare a lot of money. And that, if you put that all together, the hospital send billions of dollars to try to fix all these issues. So it's a big problem. Now, Nicole is gonna finish this up for us.
Okay, so there are some suggestions to improve safety and patient and nurse outcomes. First of all, as a team, the unit should develop a fatigue management plan. The staff should be educated on proper sleep hygiene and the effects of fatigue, such as what Kadiatu mentioned, on patient safety, and we need to provide opportunities for the staff to express concerns about fatigue and nurse burnout. The leaders should support the staff by taking actions to address their concerns and ensure adequate staff support and rest periods during times where staff members are working 3 consecutive days or 4 consecutive days. There should be rest periods. And teamwork is essential. It decreases the levels of fatigue. We should always keep the lines of communication open between the leaders and the staff. And now we come to our nurse management leadership style. So with our issue, we believe that a democratic leadership would be best because it deals with groups of workers that work together for extended periods of time, and everyone is given an opportunity to speak freely, exchange ideas, and discussion is always encouraged. And the characteristics of why this is so important with staffing is that there's less control over each other. Economic and ego awards are used to motivate the staff members, and others are directed through suggestions and guidance and constructive criticism. Communication flows up and down. Decision making involves others, and they emphasize we rather than I should do this or you should do this. They work as a team. And thank you. These are our references that we used for our project.